Is your knee pain keeping you awake at night? Are you having trouble climbing stairs without pain? Before your problem becomes bigger than you can handle, it's time to get help. Let's talk about the 3 red flags that you need to be aware of when it comes to knee pain. What's going on, guys? This is Dr. Schilling with Sequoia Health here in Woodbury. And today we're going to talk about the 3 red flags that you need to be aware of when you get a knee injury. Now, first let's start off with the 48-hour rule, because most injuries should have begun to improve within 48 hours. So if after the basic rest, elevate, and ice, and 48 hours has passed, it's time to get checked up if nothing is happening, nothing's improving, and things like that, because ultimately it indicates something has gone seriously wrong. So let's talk about red flag number 1. You can't put full weight on it. If you can't bear weight on your knee and it feels like it's going to give out on you when you step on it, that is definitely a red flag. Typically it suggests ligament damage, torn ligaments, fractures of some sort potentially. And you just want to really be aware that if this is happening for you, if you can't put that weight or put full force on it, you need to get it checked out. This is not something you want to try and wait it out and see if it's going to fix itself. Okay? Excuse me. So red flag number 2. There's an obvious deformity, like obvious change in the shape of your knee. That could be severe swelling. If one knee looks like a grapefruit or, who knows, maybe a basketball and the other one looks normal, well, obviously that's a signal that something's not right there. So when one side of your body is visibly different than the other, that's a red flag, and you don't want to just try and push through. Typically that means blood or other fluid that's in the joint because your body's trying to heal it, but you definitely need to get some urgent help at this point, okay? Excuse me. Red flag number 3 is when you hear a loud popping or a tearing sound or some type of shearing pain and a noise after an injury. Why is that important? Well, you could have torn ligaments, you could have done damage to your cartilage, things like that. Because sounds like that, although sometimes when you pop a knuckle, that can be like a joint as well, like a knee joint, because it is a synovial joint. You might move some gas out of the pocket, if you will. It can definitely indicate some type of a severe injury. So what you want to look out for are ongoing signs of pain. Typically, that's going to be you can't do your daily activities anymore. You can't do the sports you used to enjoy. It's worsening with stairs or standing up or sitting down. And it definitely stiffens after you've been seated for about 30 minutes, okay? These are all kind of indications that you want to make sure those red flags are not going to be ignored, right? You don't want to put black tape on a red check engine light. It's telling you that information for a reason. So I would encourage you to seek out someone who does a functional medicine or a functional holistic approach like we do here at Sequoia Health. So if you're in Woodbury, come check us out. If you're not, then get to somebody in your area. And if you need help finding somebody, let us know. We do this all the time. People call in all the time from all over. They say, I need help. They won't fly to Minnesota or come to Woodbury. So like, well, let's find somebody in your area. We're happy to do that for you. And you want to have someone look at you as a whole person. I pride myself as being a holistic clinician because I'm looking at your brain, your body, and your biochemistry. I want to know what preceded the injury. Like, why were you doing a normal activity that then all of a sudden resulted in injury? It's not normal. So I want to know where was the brain imbalance that caused that side of your body to be predisposed. I want to know what kind of stress was going on in your life that then predisposed that part of your body, whether it's your foot, knee, hip, ankle, shoulder, whatever it is, to malfunction, to not perform in the way you had expected it to, and ultimately result in you incurring an injury, if you will. So you want to focus on movement patterns, decreasing inflammation. There's so many different things you can look at, but it's got to be a holistic approach. It needs to be looking at you as a whole person because you are more than the sum of your parts, and they are all interconnected, and they don't have a way of dividing up, even though our traditional medical system does that. So I don't want you to wait around until pain sidelines you from your life, and I don't think you want to do that either. So I would encourage you to trust your instincts, listen to your gut. It's talking to you for a reason. It's telling you, this feels pretty serious. Maybe I should go get it checked out. If it's an emergent situation, go to urgent care, go to the emergency room, whatever you need to do. If it is, I'm 48 hours after my injury and I can't figure it out, well, if it's not causing you excruciating pain or limiting you completely, then definitely come and see us and we'll help you out with that. But you got to get to the root of the knee pain. You don't know if it was your hip, you don't know if it was your foot, you don't know if it was the inflammation. If you think about the knee, it's like gallbladder, liver, spleen, stomach, bladder, kidneys, like all these different meridians run down the leg, and they can all be a problem. or an opportunity for you to heal. So what I would encourage you to do is I want you to DM us on Instagram, KneeCheck, so KNEECHECK, KneeCheck. And what we'll do is we'll send you a link so you can schedule a complimentary consultation, and one of our team members will go through a specific process of determining what do you got going on, can we help you, and if that's the case, both of those, we can help, and we'll send you down a path of, well, here's the next step to take. Maybe it's just coming in for pulsed electromagnetic field therapy, PEMF therapy for short, where you can decrease inflammation, get lymph moving and faster like that, and get your body healing, because PEMF therapy helps you heal 5 times faster, so it's definitely worth it. So invest a little bit time and money now so you don't have to suffer for this, or through this, if you will, for a long period of time, and schedule your complimentary consultation. You got nothing to lose. Our team member is going to tell you straight up, can we help you, can we not? Is there a possibility for directing you to someplace we can help you or not? So DM us KneeCheck, and we'll figure out what your knee's really telling you. All right? Have a great day.